I can handle it.
Welcome everyone to another wonderful episode here, Doctors of Podiatry. We have a very young gentleman. This is a follow-up video on case study. Patient originally presented, when was it again? Earlier, was it Monday, Tuesday? Monday. Patient, this is the patient that we performed a regenerative procedure. We did a PRP injection to continue our efforts to maximize his improvement and minimize any long-term complications. We had him come back. We're actually doing a series of Shockwave treatments.
Tuesday.
Yes. We're going to be doing a series of Shockwave treatments to bring more blood flow to the area. We're not going to get too complicated in respect to the jargon and medical terms of the physiology itself, but what we're basically doing, he's been battling this tendonitis of the Achilles. We're able to use, and this is the original mark from the other day. And what I like to do is, I like to really start around the affected area. And then slowly move into, closer to the tendon proper. You can put this down there. No worries. The trick, very important, the gel. These are acoustic waves. So the gel helps transmit the waves deeper into the tissues. I'll go ahead and go this way a little bit now. And basically just kind of creep up on the tendon itself. It does have an analgesic type of effect, which basically numbs the area around after the amount of shocks. But again, when we talk about patient, let me know how you feel here, okay? I sort of like to work my way from the outside into the point of maximal tenderness, which is located there. But again, we're using a very low intensity. We're going to be doing a series of 4 once a week. So as you guys can see, I started a little bit lower, and then I'm moving my way closer to the demarcated point of maximal tenderness. There are definitely contraindications to this procedure, and we're very mindful of that. Indications for the use of shockwave therapy, just to name a few. Obviously this one, anything related to the Achilles tendon, whether it's something acute, subacute, chronic, preferably chronic, degeneration of the tendon. Same thing for the plantar fascia, plantar fasciosis, heel pain, inflammation of the longest ligament of the foot, any type of tendonitis, PT, posterior tibial, any tendon, any soft tissue chronic injuries. There's a lot of different indications that we can use this wonderful new addition to our toolbox. Thank you, Sebastian. Patient, how do you feel?
Fine. In the beginning, it was a little more painful.
Right, so that's very important. I'm just going to mention that again. At the beginning, it was a little uncomfortable, and now he's okay because of that analgesic effect that I was talking about before. Here in, several years ago, more of our colleagues had these machines, and then that was probably about, I want to say, at least here in South Florida, maybe 10 years ago, and then they kind of disappeared for a lot of reasons. And the problem is that the machines, just like any other medical device, machines are expensive. It's part of the problem. It's a big investment. Unlike, let's just say, unlike an orthopedic surgeon that has the scope of practice from head to toe, we only have, our scope is a little bit more limited, right? But nonetheless, our job is to help people and make sure we have all the tools in the toolbox, especially now that we've launched the Advanced Heel Pain Centers of South Florida. So it just made a lot of sense to bring this technology here to the organization. How you doing up there?
Good. You turn it up.
There you go. So we got the green light. He gave us a green light to turn it up. So now we're just gonna go up on the energy. So the shocks now are gonna be a little bit stronger. Even though he gave us the green light, we still need to be very careful and mindful that because of the analgesic effect, and the machine already has the pre-settings, so
Is it great?
nah.
But maybe.
So the machine has different heads, and I'll show you guys at the end. We're almost there. Depending on the location, smaller, bigger heads. So in this particular case, we're using a very small head. We don't want to shock good tissue. And of course, around here, there's important instructions as well. There's several other important structures on this side, so we need to be very careful. But when we talk about alternatives, right, This is what we're talking about. We try to exhaust all conservative measures. Some patients leave here feeling incredible. They think it's magic. They think it's magic, but it's not. It's that analgesic effect that kicks in quickly. So the patient we're going to continue all previously recommended therapies. We did the, like I said before, the PRP. We just did our first of 4 Shockwave treatments. That was the time anywhere between 7 and 10 minutes. Patients come in, lunchtime procedure. We send them on their way. Like always, www.josspodiatry.com, Instagram, Dr. Tojan, Joss Podiatry, Facebook, and then last but not least, our YouTube channel. Hope everyone has enjoyed this wonderful educational video.